Alhikmat Dawah Services is offering a Ramadan Umrah trip visiting Medina and Mecca on May 11th to May 20th, 2019. Group will be led by Shaikh Shafayat with an approximate cost of $24.95 per person, departing from Miami, Florida, inshallah. If you are interested in this package, please contact Alhikmat Dawah Services at USA Office 954-986-0158 or our Trinidad office 868-325-8276, or you can email us at alhikmat@alhikmat.com. Alhikmat 2019 tours from Miami, Florida to a 7-day Jerusalem tour, February 17th to February 23rd, visiting holy sites of the 3 Abrahamic religions. Umrah in Ramadan, visiting Mecca and Medina, 10-day tour from May 11th to May 20th. And finally, Dubai and India, 10-day tour from October 13th to October 23rd, visiting Taj Mahal, historic Islamic sites, and many, many more. The group will be led by Shaikh Shafayat. Contact Alhikmat office at 1-800-804-0267 or 954-986-0158, or you can email us at alhikmat@alhikmat.com. Alhikmat Tours and Travel Services now offers visa processing services to any country, also offering Umrah trips, Dubai and India tours, and many other countries. For more details, you can contact Alhikmat Dawah Services at 1-800-804-0267 or 954-986-0158, or you can also email us at alhikmat@alhikmat.com.
All praises are due to Allahu Allah. All praises are due to Allahu Allah. Allahu 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 Allah. Allahu.
Assalamu alaikum wa rahmatullahi wa barakatuh. If you would like to dedicate copies of one of these publications as Sadaqah Jariyah, continuous blessings for your parents or dear ones who have passed away, or fi sabilillah, in the path of Allah, please give us a call so we can place your names on these dedicated publications. You can call us at 954-986-0158, or you can also visit us at www.alhikmat.com.
Allah is the creator of different faces. Allah is the creator of all races. Allahu, 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 Allah.
Since 9/11, there has been a great fear of Islam.
We need Muslims, I always say, to speak up in this country.
Much of our Islamic community is perceived to be insular.
Most Americans have never met a Muslim or are not aware of having met a Muslim.
Most people don't have enough education in terms of what the entirety of Islam represents.
It's very easy to hate someone or to put stereotypes on people that you've never interacted with.
But do you think if Muslims were more integrated in society, in America, in the United States of America, then there would have been less anti-Muslim scenario?
I think it's even more important that our clergy speak up. They are, after all, the moral force in our community.
You see, the Islam that is celebrated is one which opens its doors.
Having this type of dialogue in terms of a community outreach, or
Something that Muslims have to do is go out just like you do and inviting non-Muslims to the iftar. And you do a lot of speaking to mixed groups.
We have to change the language from us versus them to a language of we.
I believe that if we can stand together against the forces of hatred and be unified in this country, then we can do wonderful things.
Bringing us together to enhance the beauty of humankind.
I think religion can be such a powerful force for unity.
Of course.
We've made it into this powerful force for disunity.
Keep trying to understand each other and care for each other and keep building a world community, because I believe that's what God wants for us all.
And I'm in their mosques and they're in my temple, and It's been a phenomenal experience. I've had a very warm and welcoming experience from all the brothers and sisters in the community.
That every human being is either your brother in faith or brother in humanity.
In Arabic, the word is lita'arafu, so that you will learn to understand one another.
And this is the truth of what it should be. You see, this is why I am so pleased to come here today, to support the work of Alhikmat.
The kind of intolerance and the violence that we see across the globe is rooted in ignorance, which we can overcome by teaching.
Yes.
Also
yes.
rooted in fear, which we can overcome by experiencing, where we can actually live in each other's presence. You know, it's rooted in this myopic kind of my way only, rather than this understanding that maybe all of us have more in common, and at the core of who we are is this truly global family that we belong to.
I'd like to say what a joy and pleasure it is to have Shaikh Shafayat as my friend, as my teacher, as my co-worker in the vineyard of Allah, God, where we work together to make this world a better place, to do God's work, to do the work which we are commanded to do as human beings.
Assalamu alaikum and welcome to Global Issues on Alhikmat TV. It is indeed a pleasure to have with us in Alhikmat studio Lymari Rivera. Did I get that name correct?
Very close.
Oh, you mean? How do you pronounce that?
Lymari.
Lymari Rivera. Wow, that's interesting. Because I'm always accustomed reading M-A-R-I-E, Maria. So in my mind, I got Maria, but it's Lymari. So it's a pleasure to have you on the show.
Thank you for having me.
Global Issues, you're a person who got a master's in healthcare, so you're well experienced in the field of health and health services. So I'm sure our audience, our worldwide audience are going to benefit a lot from your experience, your social services, your health services, and what you have to advise, and your experience as the Director of Enrollment for Florida PACE Centers. And would you like to let our audience know what PACE stands for?
I'd love to. First of all, thank you for having me today. It's an honor and a pleasure to be here to be able to share what services we provide for the community. Florida PACE Centers, it's an all-inclusive care program that is governed through the state and federal agencies. We provide all-inclusive care to our elderly community, preferably those that are low income. We're here to assist them with all of their medical needs, in addition to long-term care services, which would mean their services at home. So some homemaking services, some, not to say companionship, but some assistance as into like dressing, feeding, bathing.
Maybe soon you may have to provide some kind of companionship, right? I don't know, I'm just kidding.
So companionship would fall under the basis of our daycare service. In our PACE centers, we actually have 4 centers that Florida PACE represents. We have 3 in Dade County and we have 1 in Broward. In our centers, it's like a one-stop shop. You have a daycare center there. We also have senior activities that are for the more high-functioning ones, the ones that would like to do Tai Chi or gardening or more intricate activities. And we have a full clinic with doctors, ARNPs, nurses, and medical assistants. We are able to triage if necessary if one of our participants does get sick on the spot. We also have a full physical therapy department as well as a full occupational therapy department. A clinical dietitian who monitors and tracks your height and weight, your BMI, your rate of activity according to how much your food consumption is. We also have a team of social workers on site that assist the families and our participants with any of either legality forms or just assist them with social services in general if they would need additional services or assistance.
So all these services are offered here in South Florida.
Yes.
And then as we were talking before we came on the show, that you have other similar centers that operate throughout the United States under different organizations.
Yes.
But before we get into all these details, I'm happy that our audience would understand where we're coming from and what you're going to explain, some of these services that are available on the PACE centers. So tell us a little bit about your background. And before our audience get into their benefit of how the elder is going to benefit here, and tell us about your background. You are a specialist in healthcare. What motivated you to get into healthcare?
What motivated me to get into healthcare? Well, the line in my family. We have fortunate that many people in my family were either physicians or pharmacists, pharmacy techs, some therapists, some nurses. So I guess healthcare is just in my blood. I thoroughly do enjoy assisting the community. Some of my background is I've been for the last almost 15 years in healthcare services in one form or another. And before that, I worked in government. So that ability or that need or that want to help people has always been there.
In the health department in the government, or?
In, say, in commission, in county commission, and in local offices of city managers within the Broward County. So I've always been
community services.
Like, yes, in the community service.
So now you're in healthy services.
Yeah. So now I do community service in the healthcare field. Always wanted to be out there assisting. I know we have a lot of resources. I've been very fortunate that every role I've played in my professional career, I've been able to provide those services to many people in the community, whether it's been in the political arena, whether it's been in healthcare. I feel it's a good feeling to be able to bring those services out to people who need them, maybe who aren't aware of them.
So you're not in this career because of just the money. It's because you love the services.
No.
You are just part of it. You just feel for it. It's in your blood, your family. And that's nice because you will have a different sort of affection in accomplishing mission.
Yes, I firmly believe, treat others as you would want to be treated. And I could only hope that the day of tomorrow, if my mother is to need of services, or if myself or anyone from my family or my friends is to need of something, that the good I have put out there will, come back to us. Not to do it selfishly, but, as you pay it forward, then when in your most time of need, then you will receive some good back and
As Jesus
assistance.
said, do unto others as you would like others do unto you. Really unique. So when I look at your experience and your background in healthcare, let's talk a little bit. Again, we're going to get into the PACE and the senior services and the whole 9 yards. But what is your perspective of health nowadays? I mean, when I say that, once upon a time when you would go to a hospital, you would get sick by even looking at the hospital.
Yes, healthcare
Now a hospital looks like a hotel.
Yeah, exactly. Healthcare has come a long way. Like I said, I've been in healthcare for almost 15 years, so I've I'm glad I was there to see that transformation that healthcare has done. I'd say maybe I could count back maybe 10, 12 years ago when I first started noticing it. I did work for Memorial Healthcare beforehand, and I worked under a magnificent chief nursing officer, Maggie Hansen, and she had brought this vision into the Memorial Healthcare system of patient-centered care. I mean, this is the wave that healthcare was going into, and she's the one who initiated it in that particular facility I was in.
Now, for the benefit of our viewers worldwide, we got viewers east, west, north, and south. So there may be someone in some other country looking at this, and when we talk about the hospital is a beautiful place like a hotel, they're probably wondering what we're talking about, because in some of these countries, it is still very sickening, and more sickening than you are actually sick when you go to the hospital. It smells bad, it looks bad, things not working. But in the Memorial Healthcare, in
Memorial, and in what we try to do with the PACE program as well, the patient-centered care model, meaning that your whole focus is on your patient. We don't want you to walk in and say, I feel worse coming in here. No, we want you to feel better.
So it's a welcoming atmosphere.
It's a welcoming
Flowers,
atmosphere.
It's pretty.
Exactly. It looks like your home.
Like a reception in a hotel, huh?
Yes, if you are in an actual facility, it is like walking into a 5-star hotel because you're getting treated with, it's that customer service that's up front, it's that attention to detail. When you walk into our PACE centers, you walk in and it's warm and fuzzy. It's like home. You know, everyone knows you. The bus driver knows who you are when they pick you up in the morning. That attention to detail, Mrs. Smith, you're not feeling well today, let's walk you over to the clinic and make sure the doctor sees you immediately. It's the way that we have embraced our building to make people feel like, you know, this is their center, this is their home away from home. There's recliners, there's comfort areas, there are sections where, you know, they get to play per se, they get to do their activities, the
So actually
occupational.
all these facilities were deliberately designed
Yes.
to enhance the environment, to make the patient feel more comfortable.
Yes, exactly. We want you to feel, and I stress this, like you're at home. This is your home away from home. We genuinely care for our participants. You're not another number per se. Most healthcare right now is very commercialized, and I'm happy to say a good portion of it is just as warm and fuzzy and loving as the next person. So we do try to make you feel like, yes, you are part of our family, and we are a family to your extended family. It's not a number for us. We're not, you know, reaping huge benefits financially over this.
It's a service. It's a healthy,
It's a service.
beautiful service.
It's a service we provide.
And I really admire that. In recent times, when I move around and I check the different health facilities, you know, it is really very motivating. Once upon a time, it was very down. It put you into such a down scenario that it's really sickening. Now you can go in a hospital and sit back and relax and feel at home. So I'm sure it makes the patients more comfortable. But that's a good vision from the health point of view.
Yeah, it helps your recovery.
I mean, it's a costly thing. Let's be very honest, but good things are not cheap.
Exactly, but it also helps the individual themselves. It helps you with your recovery if you're not feeling well for whatever reason. If you, let's just say mom took a trip and a fall and now she's just not, you know, walking and as mobile as she used to be. That nurturing, that extra care, that extra attention to her physical therapy, to, you know, how is she progressing, it brings them, they feel much better. They maintain that integrity in them, that they are still independent, but at the same time they could still count or ask for assistance from somebody else that would be able to provide it to them.
Good. So now that we got over your background and we got an idea of this beautiful environment of healthcare services, tell us a little bit about the services that PACE offers. I know you gave us a little general outlook, but, or maybe before the services, how does a person go about getting involved or getting benefits or getting enrolled, because you're director of enrollment. So you're the direct person we need to talk to. How does a person, just Mr. X, as we say, XYZ, heard of this, looked at our show somewhere in the world, and realized, well, his father lives in South Florida, or his parents, or his aunt, or someone, and they can benefit from these services. How do they even think about beginning to be part of it or getting enrolled?
All right, well,
what do they need? What we need to do?
Initially, well, obviously they place a call out to myself or someone from my team. We go over what services we do provide. We do inquire what services are they seeking for, because we want to make sure we are the right fit for them. You know, this is an individual care plan that's given to each person. We're not a cookie cutter model. However, with everything, it's not one size fits all either.
So what are those things that they will have to say that they need to know that they are fulfilling the basic requirements?
Well, we would go over what would be the basic requirements, meaning they're 55 years of age. They do live in our catchment area. Catchment area meaning we are bounded by zip codes. So for Broward County, where we're at, we cover all of South Broward. So meaning anything from Griffin Road all the way down to the county line, and actually passing the county line.
So you cover only Broward right now?
Right, well, we cover all of Dade County and a portion of South Broward. Anything down from the beach all the way down to past Weston we cover for Broward. So once we've established you live in our catchment area, income is less than $2,100 a month because we do qualify them for full Medicaid, and they are nursing home eligible. Nursing home eligibility falls under 5 different criteria. It could be something as simple as you just need someone to help you at home.
Let me get that again for the benefit of our audience. Your income got to be less than
$2,100 a month, yes.
Okay. What about a person without an income?
Typically someone always has some sort of income or revenue that they have, because at some point they need to pay some sort of bills.
Okay, so so income is different to a job.
Yes, income meaning that it could be their Social Security. At that age, typically it's whatever they receive in Social Security.
Okay,
or if they have a pension.
I'm deliberately asking that question
Mm-hmm.
because the view out there is like, well, I'm 60 years, I'm not working, or I'm 65, I don't have this income. So what you're saying, Social Security, some form of income coming in from whether rental services, or I don't know, it could be
Yes,
something they
some
have.
sort of whatever someone uses in a means of surviving, basically, and paying any of their current expenses they have.
Okay, interesting.
And then the other requirement would be nursing home eligibility. Nursing home, as I was saying, it comes in 5 stages. It could be as simple as I just need someone to assist me in the house for light housekeeping, or maybe assist me with, toileting or dressing or bathing, which is sometimes the first factuals that we start noticing we need assistance with, and it could be actually to the more intense as someone needs assistance in getting out of bed. Someone really needs someone to shower them, or cook a light meal for them, or make sure that they're taking their meds.
Yeah, so they've reached this age, they got to take their medications, they got their regular primary doctor. I mean, I'm asking, you got these cases, they got their regular primary doctor, they go to the hospital or the medical places for their checkup, but at home now they live alone and they need some kind of assistance.
Exactly, they need
so someone who has a primary doctor and has some sort of schedule of going for treatment to the hospital or their primary doctor, and got their insurance that covers all of that, but they still need this sort of home assistant services because of their age and stage, and does that conflict your services?
It does.
I'm just asking
It does conflict. So we become their physician, we become their specialist, their social worker.
Good point. That's why I asked you the question.
Yes. Yeah. So once you're enrolled with our program, once we go over the qualifications, we request some documentation from your primary care physician. So our physician can review medical records and do a proper assessment. We submit that to Department of Elder Affairs.
Okay.
They provide me a level of care, meaning this is where nursing home eligibility comes in. And after I receive that first approval, I submit that with some financial statements to DCF, Department of Children and Families, because they provide me the full Medicaid. Once those 2 approvals are done, we are just about ready for enrollment. Once you enroll with our program, we become everything for you.
That's interesting, and that's solid information. Yeah. That's what I wanted to know.
So as you're in enrollment process, you still continue to your appointments, your doctor visits, anything that you would be currently doing. Once you now flip over to the PACE side, we pick up everything after that.
So now you get a primary doctor.
We have our own.
Will visit.
Yes, we have our own. So when you come to our center, it's a one-stop shop.
Is that the PACE center or some other center?
No, it's the PACE center. Beautiful. It's the PACE center. So it's a one-stop shop. We have everything there for you. So just imagine walking in, and you have your activity center here, you have your daycare center here, and you have all your disciplines all around the facility.
So your primary doctor then prescribe whatever you need, or referrals to a specialist outside.
The specialists are also our internal people.
Oh, so if you don't have a specialist for a special case, specialists come in.
Yes.
Interesting. Yes. Now that is really phenomenal.
There is a common example is someone says, mom now needs a specialist for, I don't know, cardiologist, but she can't get it for 2 months from now. Or mom needs this medication and she can't get it because it's too much and the insurance won't pay for it. We are your payer and your provider. So my physician would say, I need you to see the cardiologist. Our designated staff member would schedule that appointment for you. You're not waiting 2 and 3 months. If you need a particular medicine, you're not being denied the medicine because the insurance won't pay for it. We are fully responsible for you. We give you the medicine, we provide you that referral, we pick you up, we take you to the appointment, we bring you back home. We acquire medical records from that physician, that specialist, to then speaks to our physician, our primary care physician, and then they collaborate as to how do we continue her level of care, her care plan, and then they move forward from that. So say you're inquiring.
And this is really in great demand, you know. I mean, I want to
It's a comprehensive medical model.
It is really unique. It is really unique. And that's what I think our audience there really need to understand, that there are a lot of seniors who are totally lost. They're getting a little bit of this somewhere, a little bit of this somewhere, and they always have these problems. They cannot get everything under one roof. And you're technically being that kind of partner here now, where you offer those services under one roof.
Yeah, everything is under one roof. We have the comprehensive medical model. So say you're inquiring about mom's care plan or mom's health, or you know mom had an appointment with X, Y, and Z doctor. You just have to pick up the phone or email the social worker and say, hey, what's going on with this? The doctor will call you back and give you a full report, because we, in a sense, are the control station of everything. So we know everything that comes in and out. Like say the cardiologist cannot change mom's prescription unless our physician approves it, because she has her on a set care plan.
Yes.
They don't want, this doctor says this doctor says this, and this one, and you have this hodgepodge of mess, which does happen, unfortunately, to a lot of people because the physicians do not communicate. We, in a sense, oversee everything, so we're able then to give her the proper care plan, not over-medicate her, make sure that she's not losing services she should be getting.
Okay. What about hospital? How does your services relate to the hospital? You know, some of the primary care physicians, they work with, for example, certain hospitals, whether it be Memorial.
Well, we have contracts with all the hospitals. Memorial pretty much has 5 or 6 facilities within South Broward, and also we have Cleveland Clinic. So we do have contracts with these facilities. PACE becomes your insurance, as I said, the payer and the provider. We give each of our participants a card, an insurance card. They happen to go into the hospital, they call us for authorization.
So PACE becomes your insurance provider, because you guys got everything back here. They got a card from you. So Memorial, Cleveland
Clinic,
they will all
they would
accept.
call us automatically, yes.
Okay,
we are straight Medicare and Medicaid payments, so we do have contracts with them like any other facility would.
The reason
as well.
why I asked that is because, you know, some of the other systems, you got person goes into Memorial, they got a primary care doctor, it all reads on the same system. So as long as you got a contract, that's
we
ideal.
have contracts with them. We do have a 24-hour on-call line, so say if mom happens to fall in the middle of the night or on the weekend, we do have designated a clinical team that does come out to see her then at home. If it's something as serious as if you see blood, obviously 911 is your first choice, but then call us after. But if it's anything that's not so, you know, dire, we do send someone to the house, whether they live in an assisted living facility or home, to go ahead and check them, and then we bring them into the site first thing on Monday morning. If we feel they need to be hospitalized, then we will initiate the hospitalization, and someone from our medical team, typically our ARNP, or if not our physician, will follow our participant in the hospital and collaborate with that internalist that is in the hospital to check on the care plan and then discharge them.
But you also said you have services where you may have some health aid people go and spend some time with the patients at home.
Yes.
For a couple hours.
So we do have patient care assistants that do go to the house to assist them. Each care plan is individually done, so I can't say, oh, we give you 10 hours of home care.
Yeah.
No,
It depends on the need.
it
and the
depends on
services. I
exactly. It
understand that.
depends on the need. So say what is pretty common is where families need, mom lives with the daughter, and the daughter says, I leave to work at 7 in the morning, but I need someone to help me get mom ready in the morning.
Right.
So the PCA service comes in the morning, helps mom get up, take a shower, get dressed, make sure she's got breakfast, and then either sets her on the way in the bus to the PACE center or stays with her at the house to help her then do some light housekeeping.
Until the daughter comes home.
She will not stay all day until the daughter gets home. She's
Okay.
there for a limited amount of time. That now is considered companionship. Nobody
Yeah.
actually pays for companionship.
Okay,
But we
okay,
do
okay.
subsidize that companionship need by bringing them to the center, because we have a full team there. She would either be in the daycare or she would be participating in the senior activities that we have.
Interesting.
So if the daughter's concern is, I don't want to leave mom at home all day, understandable, because most of our participants are this way, we do bring them to the daycare center. And then they're there with us. We give them breakfast and lunch. We provide them with activities. We provide them with, physical therapy and occupational therapy, because, at any given point, you always need to keep some sort of mobility to make sure that, they're not declining. And then if they need to see the medical doctor, then the clinic is always open for them to go see the clinic.
All right. When we come back, we got to go on a short break. We have been talking for more than 25 minutes.
Oh,
yeah.
wow.
25
Time has flown.
minutes. Well, it's a very interesting topic, and it's a necessity. Health is a big thing. I mean, politicians use health as a marketing pitch. The president of the country uses health as a marketing pitch. So health is a necessity. It's actually, it's more or less mandatory for people to know about their health and what's going on. You know what I'm saying? However, the services is so important, and I'm sure a lot of people will definitely benefit from this. A lot of people are looking forward to better understanding this sort of Medicaid and Medicare and the services you offer. So we got to go on a short break. When we get back, we would like to continue a little bit on if a person has Medicaid or has Medicare or has partial whatever of present, because a lot of questions come around. I am this, I have this. How do I become part of your operation? So, and then how do they get in contact with you? How do they reach out to your services that you offer, get enrolled and be part of this whole PACE operation? All right. So when we come back, we're going to continue talking to Lymari Rivera, and I got it correct now, right?
Yes.
Good, because she's a health expert. She has a master's in healthcare. She's a director of enrollment for PACE centers. Very interesting healthy environment services that they offer here in South Florida. So we're going to continue. If you got a friend, a family, a relative living in Florida, or whoever it may be, here's an opportunity to benefit from what she has to say and what services they offer, that we can share the message. We may not need it, you may not need it, but there may be somebody that will need it out there. And you help someone today and someone will help you back when you need it, all right? So stay tuned. When we come back, we'll continue with Lymari and her health benefits that her organization offers. Thank you very much.
Alhikmat Dawah Services is offering a Ramadan Umrah trip visiting Medina and Mecca on May 11th to May 20th, 2019. Group will be led by Shaikh Shafayat with an approximate cost of $24.95 per person, departing from Miami, Florida, inshallah. If you are interested in this package, please contact Alhikmat Dawah Services at USA Office 954-986-0158 or our Trinidad office 868-325-8276, or you can email us at alhikmat@alhikmat.com. Alhikmat 2019 tours from Miami, Florida, to a 7-day Jerusalem tour, February 17th to February 23rd, visiting holy sites of the 3 Abrahamic religions. Umrah in Ramadan, visiting Mecca and Medina, 10-day tour from May 11th through May 20th. And finally, Dubai and India, 10-day tour from October 13th to October 23rd, visiting Taj Mahal, historic Islamic sites, and many, many more. The group will be led by Shaikh Shafayat. Contact Alhikmat office at 954-804-0267 or 954-986-0158, or you can email us at alhikmat@alhikmat.com. Alhikmat Tours and Travel Services now offers visa processing services to any country, also offering Umrah trips, Dubai and India tours, and many other countries. For more details, you can contact Alhikmat Dawah Services at 1-800-804-0267 or 954-986-0158, or you can also email us at alhikmat@alhikmat.com.
Assalamu alaikum and welcome back to Global Issues. Once more, it is a privilege to have with us in Alhikmat studio Lymari Rivera. And as we said in the opening of the program, Lymari is an expert in healthcare services. And we are really fortunate to have her with us in sharing her experiences, especially in the area of Director of Enrollment for Florida PACE Centers, where they offer so many services. As we promised before we went on a short break, we'll continue on discussing a little more as to people who already have healthcare services somewhere, somehow, and want to join these facilities. How do they go about that?
Okay.
So tell us.
When you enroll with the PACE program, your primary care physician, your specialist, your social workers, your caregivers become us, our network of people. The beauty of having a comprehensive care model is that we become...
I like that word, comprehensive care. So this is more a comprehensive care.
Yes.
So a person who already has a primary physician, got certain doctors they go to, certain things here, there, all over. You are saying that this is a comprehensive healthcare service, one-stop shop, as we would say.
Correct.
And you get everything to come by. How does that work? How do they give up what they already have? How does this work?
Okay, so one of the obstacles that we see when someone is considering enrolling in the PACE program is that they already have their primary care physician. They already have their set specialists. Because we are located in South Broward and we do have contracts already with the Memorial Healthcare System, if someone tells me my specialist works on the Memorial, that specialist works under us as well. So as for specialist-wise, from your podiatrist, your cardiologist, your neurologist, this is all already covered under us as well. We have the same physicians on board. The only major change that they would have, and I say major depending on how they see that change, is their primary care physician. Most primary care physicians would say, yes, you do need more comprehensive services. You know, I suggest for you to enroll in another program because that have that genuine concern for their patient. I invite families over if they are struggling with that decision to come and speak to our medical team. So then they could get an understanding on how the care would continue. It's not going to be a drastic change of care. It's a continuum of care that we provide, but now with the extended services that are needed for mom and dad. They'll come by, they'll speak to our clinical team, they will get to tour our center, they will sit down with our therapists that are on board as well as our social workers and stuff. And then typically, by the end of the conversation, people will say, yes, we are ready to enroll, to begin the enrollment process with the PACE program, because they do see that, you know, not immediately today or not next week or in 5 years, they see that the long-term care services that we do offer are the ones that would be best for their loved ones.
So let me ask a question, hypothetically speaking. Somebody joins you, enrolls with your services. PACE centers, as you call it, all right? After a month or two, doesn't really feel too happy. I don't know, I'm just thinking 9 yards down the road. Are they able to go back to what they were on before?
Yes. PACE centers, once you do...
I'm just trying to be provocative
because
that's the question someone would want to ask, you know, what if, you know?
What if, can they get out of it or not?
You know, today someone goes to the mall, buys themselves a dress that they love so much and they always wanted, takes it back home and realizes
puts it on and it looks horrible.
Yes, that's not
and
what
they're
I
gonna
wanted.
take it back.
And they
yes.
want to know, could I go back, get my money, cash back my card?
And it is.
I'm just asking it. It's the human mind.
Of course.
It's a reality.
But it is a realistic question. Most managed care insurances that people do have now have a certain date to enroll and a certain date to disenroll. With the PACE program, you can enroll at any time throughout the year, and you disenroll always at the end of the month. So let's just say you've enrolled mom in the program, and for whatever reason, mom says, I don't want to go back.
Or mom is changing her address.
Yes.
And now you don't cover that geographically speaking.
Yes. She enrolls. Disenrollment happens always at the end of the month. So let's just say mom is getting ready to move, which typically our disenrollments are because unfortunately they are now at another stage in life, or because they're moving out of our area.
Or at some other family member or son or daughter to live with or something like that.
Exactly. So they're moving out of our area. So disenrollment happens at the end of the month, meaning that mom is disenrolling now. I am still fully responsible for mom. So say mom is going to move to West Palm Beach. She will continue to get services from us until the end of the month. It could be the 5th day of the month. Until the 30th or 31st of the month, we would make a point of sending a nurse to go see her in West Palm Beach to make sure that she's still, in adequately
Even though
good
it's
health.
out of your geographical
Yes,
boundaries.
because she is still within our catchment
The
area.
month.
Yeah, for that month, she is still enrolled with our program. Say if she's just going to, she's moving out of state, or she just does not want to be in the program. She says, I'm too healthy for this. I don't feel like I need to be there, and all the services are overwhelming for me. Let's just speculate that. We still follow her until the end of the month. We still call and follow up, make sure that she's taking her meds, make sure that the if she needs PT, physical therapist will go out to the house and do a visit and just check her. So we do also our progress notes and document until the end of the month.
So could she, or how does she reconnect to her previous primary care doctor, physician, or get back to what she had before?
She would be open once the first hits. She would be open to re-enroll with whichever plan that she was designated to before.
And from your experience, those plans, do they now easily enroll that person, or say, oh, you guys went with PACE?
No.
We have no space for you.
No. These plans always have space because people are enrolling and disenrolling all the time.
Excellent. And that's something I think our viewers would love to know.
No, they do. Within that transitional stage.
Because people are normally scared,
Yeah,
what
do I enroll? Do I not enroll? What do I do? What's going to happen? So during that transitional stage, family member can reach out to our social worker team and say, hey, mom is moving out of town, and can you offer me some guidance as to how do I get her now into the next plan? And so our team will assist the family and say, oh, she was with Humana before. Let's see if we can make contact with a Humana representative and start getting you set up for the beginning of the month.
Okay.
So they will help them transition into the next stage if necessary.
Interesting. That is nice. I wanted to make sure I ask you that question because that's a big full stop for a lot of people. They got, before we got on the show, you were talking about married and unmarried. Some people just think they're married to whatever insurance or whatever primary physician they got, and they're scared to do any movement, not understanding that there's so much more benefits out there. So I'm glad you explained that. What else would you like to tell our audience about your facilities, services? I know we need to let them know where these facilities are located. I think you mentioned it in the beginning, but for viewers who would have just tuned on, where are these facilities?
We have 4 beautiful facilities all together under Florida PACE centers. 3 of them are located in Dade County, which is in the Miami area, around the Wynwood area. The next one would be in the Hialeah area, and the 3rd one would be in the Westchester area. So we cover pretty much all of Dade County except for the Homestead-Kendall area. And then for Broward County, like I said, we are in the South Broward area portion, so anything from Griffin Road all the way down past county line, all the way east to the beaches, and all the way west past Weston.
So where is this facility located?
Our Broward facility is located off Miramar Parkway and Palm Avenue. It's in the Corporate Park Center that's located within that corner there. So we're in a good spot. So we're not too east and we're not too west.
Yeah.
And then I would invite someone who's interested. I always invite them, please let me know when you want to come for a tour. I have staff members
So where
in
are
all
you
sites.
located?
My main office
In all
is in
different
Miami.
areas?
Yeah.
Oh, are you kidding?
My main office is in Miami. However, I go from site to site to assist my team. Say, if someone wants to take a tour and the two girls I have working in Miramar, they're busy doing an intake or with family or something, I come in and I provide the tour for them. In our group, we're very team-centered, so it's not that I'm the boss and you're the subordinate. We all work together, and that's how we foster that relationship with our participants. So
I saw in your email Jewish Health Care or
Yes.
something to that effect. What is it really?
our parent company is Miami Jewish Health, and they are located in Miami.
Jewish Health.
They're located. That's where our first PACE center is. We have been open now for 15, 16 years. Florida PACE centers. Miami Jewish Health has been open for the last 77 years in the community. So our first PACE center is
So what are the
located on
services
campus.
Miami Jewish Health offers? What are the sort of branches and
Well, Miami Jewish Health has actually the largest nursing home in the state of Florida, and at the same time, the smallest hospital in the state of Florida. We do have on site, I don't exactly remember the amount of acres, but I think it's 20 plus acres we have on site. So we have an assisted living facility building, a senior housing building, like I said, a hospital, a rehab center. We have our PACE center that's located there, and again, the largest nursing home.
wow.
We are also venturing into the area of Miami Lakes. Very happy to say we will be having a nursing home / assisted living facility building there. And in Pembroke Pines, in the heart of Pembroke Pines, we do have our Douglas Garden North senior housing buildings, and we're also building 2 more buildings there to be able to provide housing for the low-income community of our seniors.
That, these are some really interesting necessities that the communities need. at
Yeah,
this
Miami
time.
Jewish, the focus of Miami Jewish is all around the elderly community. Like I said, we've been in business for the last 77
And
years.
Florida is the place to have that going because this is where people go to Canada, North America. When we say North America, places like New York and all these areas make their money and then decide to come.
They
in
come
the
and retire
resort-
here with us.
in this resort of Florida. I call it more resort area as opposed to being a retirement area because it's more like a resort, huh?
Yeah.
The facility is like a resort. It's so different to other states and other operations. So if someone wants to contact you, what numbers do they get you at? Where do they call?
So they can reach me on my cell. My number is always available to anyone. The number is 305-988-1364.
305-988-1364.
If they can't reach me, if they get the voicemail for whatever reason, they can also text me. So there's various methods to communicating with me through my cell phone. If they reach to contact the office, it is 954-441-7079, and that is directly to our Miramar office.
441-7079. 954.
954
Excellent.
for the Miramar office, and they could speak to either myself there or Denise, that is the intake specialist for that site, and the enrollment coordinator for the Miramar site is Najida.
Excellent. The reason why this is so necessary, especially Florida, in comparison, you got California, you got New York, because of the diversity and the different cultures and people from the Caribbean and from different, not just the Caribbean, we're close to the Caribbean, but people from all over the world, the multicultural diversity that we have here in South Florida is so important, and a lot of these people, they don't know that these facilities are available. They don't know the services are available. They just go by what they hear and what they see, unless they're really working like you into different facilities, then they share it with their family and friends. But other than that, it's really a blessing to have you with us in Alhikmat Studio, that you can really share this sort of information to the world out there. And I think the whole world is connected to Florida.
Yeah, and
if at least it means come to visit Florida.
we're very conscious of our community we have out there. Our social workers, one of them does speak Creole along with English and Spanish. The other one is Spanish and English. On my intake team, one of the staff members speaks 5 different languages.
Oh, you kidding?
It is Spanish, English, Portuguese, French, I forget which other one. So we try to adapt to our community, and we try to, bring services to them that are necessary, for them being able to assimilate better, them being able to connect with us. If I have someone who speaks Creole, I definitely cannot speak Creole. I'm very fortunate in my team to have 2 people who speak Creole. So we're able to then make that connection with them. I said we're in service.
And as I was saying, because people come from a very diverse background, some people are just shy. They will go to the public hospitals, they will go here and there, but they're shy to come to private nursing homes and private services because they feel that they will not be welcomed. And I'm so happy to hear that that's what you all are all about, welcoming people. I mean, as long as they handle the insurance properly and the 9 yards to do with the legal technicalities. But other than that, a lot of people this shy away. I mean, are you familiar with that sort of thing? They don't know.
And that's where most people would have, say, that language barrier. So as I said, I'm fortunate on my team. I do have people who do speak multiple languages. So if we do have someone reaching out to us, or if we do visit a community event, we are able to then speak to everyone. We are able to at least relay the message of these are services for you. As you're comfortable, as you're in need, if you have questions, and you can reach out to us, and we are able to then bridge, say, that communication gap they might have with another company or with another service. We're able to provide that for them.
So last but not least, I mean, I'm going to give you the last word, but one more question. What do you need to see at the very beginning to have an idea, or let's say the patient or this person, what is the basic thing that they got to have in their mind that they can come to you and know that they will be accepted? Forget about the insurance. That's the legal technicality. Forget about their legal status and insurance. What do they have to need to know that we can benefit or we should enroll with PACE? Because, you talk about 55 years. So there is a 55 years old guy or lady, healthy, normal, but goes to a doctor, got a primary health care doctor, takes regular checkup for the eyes, the blood, the body. Does that person fit into PACE?
That person can fit into
How?
PACE. We provide for all their medical services, and we prepare them from here to the coming years. We're not with someone just
But you follow what I'm saying? This person is working, is not bedridden, is not home.
None of our people are bedridden. If you're bedridden, at that point, there's not much services we can give you. So we have people who drive themselves to the center. They don't rely on our transportation. They drive themselves to the center.
But that's an important point. You got a healthy 55 years person, 56, 57. They just got a primary health care physician. And they're just doing their regular blood, their eyes, their this, that.
Their
and
regular
taking care of the normal
checkups.
9 yards.
They go see their regular, specialist if they have one. We do have several people who come for the socialization portion of it. They come to socialize. That is their therapy. They come, they have their network of friends there already. They drive themselves, they see their doctor, they come back to their little table, they share lunch. They have, we actually have a particular group which is from the Caribbean.
So when I reach 55, I could come in and check it out?
You could come in, yes. I invite you now. Come and take a tour. Take a tour. You will see our groups. We have our little groups of people who come and they share lunch. They bring something.
That's
like, oh, my
interesting.
daughter
That's
traveled and
interesting.
here she brought something for all of us. They're sharing, let's just say, a fruit cake that someone brought in from wherever they were visiting.
So it really has a family-friendly fraternity kind of environment.
Yes.
Yeah?
It's most people use it, those that are higher, and I say higher in cognitive skills and mobility, it's their socialization time.
I like that because, a lot of times people think when you talk about healthcare services, it's when you're just down and out.
No, it's not only when you're sick. Socialization is healthy for the mind. We have domino tables. They come to sit and play dominoes. We have computers set out for them, so they come and we assist them. And this is how you get on your account. Do you need to make sure your bills are paid on time, Mr. Smith? Do you want to connect with your daughter on Facebook? Let's set up that Skype or that FaceTime that we need. So it's not just because you're sick and you need the services. It's because there's more to you than just your physical health.
Yeah, and you know, you're saying that, but it's passing through my mind like a motor car. Once upon a time, people would take a motor car to a mechanic only when something is broken. Nowadays, it's about warranty.
It's your checkup.
It's about prevention. It's about a checkup. And in doing that, you 100% prevent the car from getting broken. When you trade in a motor car nowadays, in comparison to 30, 40 years ago, you trade in 100% good working car. So what you're seeing in the health world, and I mean, marketing is my line, and that's what I see happening here. In the health world, we're talking about don't wait to be down and out before you look for medical services. At a healthy level, you keep checkups, you keep yourself going so you can benefit, and it's all about serving you and making you healthier. Good.
Well, it's preventative care, so we
Preventative care, that's
encourage
the right
that.
word, yeah.
We do encourage that. Like I said, a lot of them come for socialization. We actually have some of our participants. One is in flower arrangement. It's what they did in their previous life.
Wow.
So they come and one of our activities, he actually teaches our other participants how to do flower arrangements. The other one makes jewelry. So they want to be involved into that next level as well.
Yes. I need to come and see those facilities. Which facility should I come and visit first?
The closest one to here is the Miramar one. I'd love for you to come by.
Good, I'm going to do that. Because, I know a lot of people know me, and I can be able to share this experience. We always thought, really, it's only when you're down and out you start looking for medical services.
It's before you get to that point.
Yeah.
Before you get to that point. So we could reduce that decline for you.
Good. Well, thank you very much. We have gone more than 45 minutes in our talk, and if there is anything you want to say for the next second or two as we close the show, feel free to tell our audience.
I just wanted to thank you for having me on the show. It's been my pleasure. Always happy to be able to bring information out to the community, whether it's joining PACE or not. We're here as a service for you in any aspects that we can give. And again, I'll leave you with my phone number if someone does want to reach out to me just to even ask me a question or inquire about other services they might be needing. It's 305-988-1364.
1364. Well, it has been a pleasure talking to Lymari, and I got it right?
Yes.
Rivera, who is a director of enrollment for PACE centers here in South Florida. She has an MA in healthcare services, has a great experience in working with different organizations over the past years. So we benefited a lot by talking to her generally on healthcare and health services, and I'm sure you, the viewers out there, would have benefited a great deal. So feel free to contact us here at Alhikmat office, or if you remember her number, feel free to give her a call. You don't, call us at Alhikmat office. We'll refer you to Lymari Rivera, and she can tell you how to get on to benefiting from PACE centers and to benefit from all the health services that they have to offer. So thank you very much. It has been a pleasure being with you, and thank you very much, Lymari Rivera. And I gotta really be careful to make sure I pronounce your name properly. And it has been a pleasure to be with you and our audience. Thank you very much again, and Assalamu alaikum.
All praises are due to Allahu Allah. All praises are due to Allahu Allah. Allahu 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 Allah. Allahu.
Assalamu alaikum wa rahmatullahi wa barakatuhu. If you would like to dedicate copies of one of these publications as Sadaqah Jariyah, continuous blessings for your parents or dear ones who have passed away, or fi sabilillah, in the path of Allah, please give us a call so we can place your names on these dedicated publications. You can call us at 954-986-0158, or you can also visit us at www.alhikmat.com.
Allah is the creator of different faces. Allah is the creator of all races. Allahu, 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 Allah.
Salam alayka, ya Habib.
Bounty Kings, Bounty Castles presents brand new luxury castles for all events. You can contact us at telephone number 749-4342, or you can also email us at bountykings1@gmail.com. A-Class Glamour presents to you wholesaling and retailing of premium lines of cosmetics for all skin types, designer jewelry, and many accessories. Brands include ColourPop, Maybelline, Revlon Professional, Urban Decay, Sephora, and many more. To get a hold of these products, you can call Sadiq Khan at 345-5824 or Amira Khan at 759-6089. You can also visit our Facebook page at A-Class Glamour to follow for newly released lines of products.
Truly he is the one, he has no father or son.